Good morning to you and good morning to all those who are tuning in. For what it means in terms of human pain and grief for all Cubans, today we want to begin this information giving our condolences to the relatives, to all the family members, to all the Cubans who feel sorry for the death of up to this moment of 51 people in our country as a consequence of this COVID-19, which has a high lethality and that unfortunately produces many deaths. With much pain and in the name of the Ministry of Public Health and of the state and the Cuban government and the party, we wish to express our condolences and deepest sympathy to all the relatives, friends, and co-workers of this deceased.
Todos los familiares y amigos y compañeros de trabajo de estos fallecidos. Y como yo decía, hoy tenemos
Today we must also report the death of two more people. One of them is a 62-year-old male patient from the municipality of Old Havana with a history of high blood pressure and diabetes mellitus. He was admitted since last April 7th at Salvador Allende Hospital. His clinical condition worsened. He had spent 9 days in intensive care unit and he was reported in a critical condition, and he passed away yesterday after he suffered a respiratory arrest. The second fatality we have to report yesterday is a 60-year-old female patient from Havana, from Marianao municipality, with a history of diabetes mellitus and obesity. She had been admitted to the Salvador Allende Hospital, and on the 17th day of her evolution and the 5th day in the intensive care ward, her condition worsened with a respiratory arrest, and it was not possible to save her. So we would like to reiterate our condolences to the relatives and friends of these persons. Let me now turn to the situation in our country regarding the presence of this disease. Let's first concentrate on the foreigners and visitors who are here in Cuba. We have a total of 11,526 visitors who remain in Cuba. Of them, 6,759 are Cubans who reside abroad, and 4,763 are foreigners. We always report on this group because at a given moment it was a high-risk group. At this time, since there are no incoming flights, many of these people have been here long enough to have developed the disease. In rental houses, the data remains with 943 foreigners in the same municipalities that we've been mentioning over these past days, which are Santiago de Cuba, Plaza, Playa, and Centro Havana in Havana. A total of 3,462 patients have been admitted in our hospitals. 33 patients are under surveillance. 2,582 are suspected cases, and 847 are confirmed cases. At the primary health care level, we have 6,560 under observation. Yesterday, our laboratories processed 1,857 samples for the detection of a virus, of which 689 were made at the laboratory of the Pedro Curie Tropical Medicine Institute, 336 at the Provincial Center of Epidemiology and Hygiene from Villa Clara, 252 were conducted at the Provincial Laboratory in Havana, in Santiago de Cuba Laboratory 212, in Havana Civil Defense Laboratory 238, in the Genetic Engineering and Biotechnology Center 67, and at the Molecular Biology Laboratory for the Brothers Ameijeras Hospital 63. As a result of the study of these 1,857 samples, 52 patients were diagnosed with SARS-CoV-2. This represents the 2.8% of the processed samples. Hence, 37,991 samples have been studied and 1,337 have tested positive. This represents the 3.5% of the processed samples. Of the 52 new cases, confirmed cases, all were Cubans. 34, that is 65.3%, were contacts of confirmed cases, and in 18 cases, 34.6%, the source of infection could not be established. In these cases, after the investigation, the source is ultimately established. But in other cases, it cannot be established, and this is why these events of local transmission are open in several territories in our country. Of the 52 new cases, 55.7% were male, and as it has already become customary in our reports, 53.8% of the confirmed cases were asymptomatic. The age group with the most cases is the one from younger than 40 years, with 25 cases, followed by the age group of over 60 years with 15 cases, which is the 28.8%. The province of Havana has the most cases with 29 of the 50 confirmed cases, and Mayabeque province with 11 cases for 21.1%. Of the 1,337 patients diagnosed with COVID-19 as of today, 836 show a stable clinical condition. We grieve the loss of 51 people. As I said earlier, 2 more reported today. We have 2 evacuees, 2 foreigners, and 437 people have been discharged from hospitals. 21 more people than the day before. We are reporting 6 patients in critical condition, and we have 5 in serious condition, 1 more than yesterday. The world is a bit unsettled. It remains with the presence of 182 countries with the COVID-19. Yesterday, 80,067 new cases were confirmed, for a cumulative of 2,668,135 cases. Of these, in a single day, 7,428 people died, for a total of 190,236 deaths, for a lethality of 7.13%.
superior a la del día de ayer.
The region of the Americas also reports a growth in numbers, reporting 1,042,525 confirmed cases, 36,865 more than yesterday. And the cases of a region accounts for 39.07% of the total number of cases in the world, with 3,967 fatalities in a single day, for a cumulative total of 58,917 fatalities, for a lethality of 5.65%. This is the information we have for today. Question for the Central News Agency of Korea. What is the method of application of alpha-2b interferon? The method of application in suspect patients as well in those already confirmed with the disease, it is applied from the first week, and it's applied 3 times a week by intramuscular injection. This scheme is maintained, and its main objective is to build up that person's immunity to face the virus. There are suspects that are not yet confirmed, and the interferon is administered to them as well as to the confirmed cases, so that their evolution of the disease is better. There is a modality that is through nose drops, which will be applied to groups of population very exposed, for example, health workers. We're not talking about sick people or suspects, but people who are very exposed. The administration of the interferon of alpha-2b will allow them to improve their immunity to defend themselves from the virus. And it's something very important to point out that this is a Cuban product, which is the result of the research conducted in our country. There is even a report, Professor Luis Herrera, in which he explains the whole story of how all this came about under the leadership of Commander-in-Chief Fidel Castro, in which different modalities of treatment and scientific development were sought. In China, it was applied, and it's applied in a very important way. There in China, we have a factory that produces this interferon. Question from Revista Bienvenido España. People who have recovered from the disease are known to have agreed to donate hyperimmune plasma. What are the requirements to make these donations? This is an experience that is not new. When the large Ebola outbreak occurred in West Africa, hyperimmune serum was used to treat people infected with the virus. This is logical. This serum is taken from a person who have already suffered the disease, and this person has developed antibodies to defend against it, and that person managed to be cured. Then it is administered to a patient who has the disease, so that his immune system reacts. As he receives it, he's getting ready to defend himself from the virus. We had the honor that a Cuban doctor, the only one who became ill with Ebola during that mission, Dr. Felix Baez, once he recovered, he donated his blood for this purpose. In the case of the COVID, the same is done. I've been checking, and the procedure is called an automated plasmapheresis method, and it is performed to extract hyperimmune plasma for therapeutic purposes, which has been used in different countries. 6 provinces in our country are developing a blood plasma protocol to be used for this purpose. Next week, Camagüey will be added. Cienfuegos, Villa Clara, Santi Espíritus, Matanzas, and Ciego de Ávila are already working on this plan. They have already collected 17 donations, and it has been known that the impact of their use is noticeable and that it has benefited patients to whom it has been applied. The necessary requirements to make the donation, it is proposed that the convalescents are immunocompetent people, that they are people who have completed their required recovery time, no less than 21 days, that they feel well physically and emotionally, and that they meet indispensable health conditions for any blood donation. Therefore, the answer is affirmative. Our country uses this method, which is part of the treatment of the many that are continuously being sought to achieve the recuperation of people who unfortunately acquire this disease.